Hey, everybody, this is Joel Kahn, medical doctor, cardiologist, clinical professor. I want to tell you about a really exciting clinical research study that's in the medical journals, but it's all over the news everywhere. And I think it's worth sharing because it's so hopeful and it's so exciting. I'm going to give you the name of the article. It's a little long. It's in a really prominent cardiology journal called Circulation. It's already published, so this is final science. It's called The Impact of Produce Prescriptions. I didn't say drug prescriptions, produce prescriptions on diet, food security, and cardiometabolic health outcomes, a multi-site evaluation. The lead author I know is Dr. Dariush Mozaffarian, a very well-known nutrition specialist in Boston. And there were about 8 other authors. And what they did was very simple. They took 22 sites in 12 states that identified 3,800 people at risk for poor health from low-income clinics. This was done between 2014 and 2020. About 2,000 of these 3,800 people were adults, and really heartwarming, about 1,800 of the 3,800 were children. What were they given? They were given a coupon to get fruits and vegetables from markets, grocery stores, farmers markets, about $60 a month worth of fruits and vegetables. And they got these for at least 4 months and up to 10 months. So a relatively short-term dive into increasing their access to fruits and vegetables. Great fiber, great phytonutrients, vitamins, and minerals. What happened? It was successful in that the adults increased their fruit and vegetable intake by about a cup a day on average, and children increase their fruit and vegetable intake by about 0.26 cups of fruit and vegetables a day. So people did use these produce prescriptions. And what they found in some measurements that were reportable was in the diabetic population in these 3,800 people, the hemoglobin A1C 3-month measure of blood sugar control improved by 0.3%. That's a meaningful and significant improvement in diabetics. How about high blood pressure? Those with high blood pressure experienced a drop. Systolic blood pressure averaged 8 millimeters of mercury lower, and diastolic blood pressure 5 millimeters of mercury lower. That's like a drug. That's really powerful from fruits and vegetables. And finally, weight went down. They had more data in the adults, but weight went down measured by BMI. So within 4 to 10 months of eating more fruits and vegetables, we're starting to reverse diabetes, starting to reverse obesity, and starting to reverse hypertension. Imagine if they keep this up, have lifelong exposure, lifelong access to just a cup a day extra of fruits and vegetables. I mean, we talk about ideal being between 5 and 10 cups of fruit and vegetables a day. And during the course of a week, trying to get maybe 30 different fruits and vegetables, because that's diversity for your microbiome. But even if you just get a cup a day as an adult and a quarter cup a day as a child, there's measurable improvements.